Well, my official role is People and Specialist Services Director. So I look after the people side and culture side of the organisation, which used to be called HR. And then the specialist areas are outpatients, all the outpatient services that we provide, the radiology service and the chemotherapy and infusion unit.
That's big!
Yeah, I have other bits like health and safety, emergency management, privacy, data and digital. So I'm kind of like a general operations type person, I guess.
Yeah, that's huge. So when you say outpatient services, what kinds of services fall under that?
So it's called planned care. So it's where you come for, it's not an acute health issue. So we have a lot of specialist doctors visiting us from mainly Dunedin. We've got 29 different specialties that we have here in outpatients. So we have orthopaedics, cardiology, oncology, gynecology. We have a lot. So we have specialists. They either fly in or they drive, and they provide clinics for us here for the patients, so that they don't have to travel to the main centres, which is great. We also have specialist nurses that do clinics. We have allied health staff and technicians. So we have allied health staff doing paediatric audiology, so hearing checks for young children. And we have technicians doing retinal photography screening, so they're doing eye checks for people that may have diabetes or have diabetes. They're quite busy sort of services that come quite regularly. We do procedures, so we have minor procedures here. For gynecology, for example, the general surgeons come and they might do gastroscopes, where they put a tube down your throat and see what's going on. We have quite a busy service for colonoscopies. So we have gastroenterology specialists come with a nurse practitioner, and we have a team of about 5 nurses working with them for 3 days every month, and that's where people come in and they get, it's called a colonoscopy, where they look at the bowel and take pictures. They might remove polyps, do that sort of thing. One of the great things about here is that for that service, sometimes it doesn't work, and the person's had 3 days of preparation to get their bowel in the right condition for that procedure. And if it doesn't work, we can take them straight across to our radiology service, and they can get a CT colonography. So they're all prepped, and they just get a CT scan in that condition, which is really good. It's like one lot of prep and not having to come and go for a lot of days. So it's really good, because if you've got all that prep on board and you have to travel to Dunedin, you're not feeling that great, have to stop at the bathroom quite a lot. So it's really a really neat service that we can have here for the people in the community. Yeah, so that's just an example of a really amazing service that we can have here with our specialist team, working with people so they don't have to travel to Dunedin or another centre. So yeah, we have about 29 different specialties coming. We also have the mobile surgical bus here. We have the women's health bus come, breast screening, mammography and mole map. And we also do a lot of other procedures like cardiac testing, ECGs, things like that here. Besides those, we have about 6,000 different contacts with patients here every year. It's growing. We were more like 4,500 to 5,000 last year, so it's definitely a growing area in healthcare here. But it is great that our specialists come here to see people to save them travelling.
Yeah, awesome.
Yeah.
So why is it so important for patients to have chemotherapy and other specialist treatments delivered here rather than travelling?
For chemotherapy, you might need a 4-day treatment every, say, 4 to 6 weeks. And if you're having to go to Dunedin for that, you'll be away from your home. You might need a support person with you, so that it affects your ability to work. And just that dislocation from home. And if you're not feeling that great, there's nowhere better to be than in your own home. So that is a wonderful service that we can offer in the community, especially for people going through such a big thing in their life. They get to know our team really well, but they're coming in regularly, and so it's a really lovely, compassionate environment for people to be able to come to and have that treatment, which isn't always that nice. Yeah, the patients love it. They often comment that it's great having the service here. They're really grateful. We get a lot of compliments. Our chemo team are always getting chocolates and baking, and we've had a lot of donations because people really appreciate being able to have that treatment here by a team that care and go the extra mile. I guess what's lovely about a rural community is how everyone works together to make things happen. We had a situation last year where there was an accident in the Cromwell Gorge, and we had some very expensive chemotherapy coming through via courier. It came from Christchurch, and they couldn't get through the gorge, and that delay for that treatment would have been quite a big impact for that patient's treatment protocol. The chemotherapy in this situation only lasts so long, and it takes 4 or 5 hours to deliver. So not getting it could mean that $5,000-6,000 worth of chemotherapy could have been wasted. Patient didn't get treatment. So that's where I helped the team that were really busy, the nursing team. I said, no, I will try and get this through, and I rang New Zealand Police and explained the situation. They rang the courier company, I rang the courier company, and we worked together, and they police escorted this chemotherapy through, and they delivered it to the door, and it was amazing, and patient was so grateful. And that's a way that the community works together to make things happen for people, and that was a really neat thing. So as the population grows and the demand for chemotherapy and other infusions, it is quite pressured in our unit. So we've had to be innovative about how we can grow in the limited facility we've got. It was designed for 3 chairs for chemotherapy delivery, and now we've got 8 chairs in that room, and we expand into another room that's used by other areas of the hospital as well. But we're really at a pressure point. Originally it was just 1 day a week, that service, and now we're 4 days a week. And we do need to look at opening 5 days a week or growing our facility because it's very pressured. We have to unfortunately let people know you can only bring 1 support person with you while they're having their infusion, and it would be nice often to have more space and a little bit more privacy for people, and also make it easier for our specialist nursing team to work more easily with patients. So it's actually quite urgent. We're getting a lot of infusions for non-cancer conditions, people with conditions for gastroenterology, complications, or rheumatology or neurology, and these drugs, they're called immunotherapies, and they're growing and growing, and as Pharmac approve more drugs for more conditions, the demand does grow. So it's quite urgent really that we look at how we can manage more in the area. So we're really excited about the foundation. We are a trust hospital and we do have to fundraise. Our community is so invested in what we do here, and we love being able to be involved in fundraising to support the services that we deliver, because we can't get it all from the public health system. So any donations that are tagged to, for example, the chemo unit, we love getting those so that we can improve the service for the patients. We recently bought 3 specialised chairs for chemotherapy that are a lot more comfortable, easier for the staff, and they're not cheap. So those things are great, and that's where the foundation, being able to drive our fundraising, raise our profile, is really exciting. So yeah, the government only provides a base level of funding, and we all know the health system's cash strapped. They do look after us, but our community love having the service here. They value not having to travel and being able to come here, and they are invested in Dunstan Hospital and being able to contribute to capital items that we have to fundraise for, that we don't get out of our health funding. That's amazing, because it means we can have things there for the patients to make their time here easier and easier for staff. Things like we recently got a platelet mixer, which means that we don't have to get platelets and blood products fused in Dunedin and then brought up here. So it means it's more flexible for when people can come and get their treatments. We got a
You don't have to say it.
No.
You probably wouldn't use it anyway because
No.
you don't have enough length in the thing.
Okay. Oh, thank you. So last year we delivered more than 6,000 specialist outpatient services here at Dunstan, and that means that 6,000 visits for people, they've received that closer to home, and that means a lot. So last year we had 1,900 infusions delivered in our chemotherapy unit. That was not just chemotherapy, but other infusions for cancer, but also for non-cancer conditions. That's grown massively, and that's where the need is, and great to have those people able to get that closer to home. So being able to provide those infusions here saved people having to drive long distances when they're not feeling that well to Dunedin or Christchurch, and being able, and also their carer. That saved patients hundreds of visits to Dunedin for them and their carer, and that's important. For patients, being able to have their treatment closer to home is so much better for them. It means more time at home with their family and whānau. Being able to be treated locally means less stress for patients, and it means everything. This hospital belongs to the community, and every time someone supports the foundation, it affects patient care in a positive way.